And hello, everyone. I'm your host, Doc Bob Lee, and you're watching Open. It's a live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us through social media at BronxNet TV. Leading things off, this month, the Bronx Community Health Network will launch their outreach van. Watch out. Joining us with all the details and the many programs, we have a community health programs developer, Renee Whiskey, and community health, I'm not even going to say anything behind that, and community health worker Matthew Carrion. Welcome to the show, you guys.
Thank you.
I know they've been messing with you about your last name for.
Yeah, I can
Let me have a sip. Let me have a drink. You know, you probably heard that all your life. Right?
I can take it.
You can take it.
Yeah.
But don't worry about a thing. We've got you covered right here. Tell us more about the program.
Sure. So Bronx Community Health Network is a federally funded health center. We have 21 health centers throughout the Bronx. And we also have a community arm, that's our 501c community-based organization arm of our program,
Yes.
where we go out into the community, we promote health and wellness, early treatment, disease prevention and management, and we're really excited. In the next few weeks, we're going to be launching our mobile health van, which will allow us to take our show on the road. We'll be able to provide some health screenings in the community, meet people where they are, connect folks to doctors, health insurance. And one of our signature programs is our Naloxone distribution. And I'll let Matthew tell you a little bit more about that program.
You're going to be playing music on the outside of the vehicles, taking it to the streets.
Sure.
Something like that. Yeah.
We'll make it fun.
That's a beautiful outreach, right? You take.
Yes.
What kind of screenings are we talking about?
So we're going to be offering blood pressure screening. We'll be partnering with other organizations to provide HIV screening, rapid testing. We're also screening for health benefits like SNAP, helping people complete housing applications, all of those social support services that the community needs.
And people need help with that because, you know, sometimes you're involved in a lot of stuff, you know,
Absolutely.
New York City.
Absolutely.
And sometimes you need somebody to help you with this and help you with that and maybe hold your hand and walk you right through it.
We want to meet
And you have
people where they
those
are.
capabilities.
So, absolutely. So Naloxone is one of our signature programs. Matthew is our
Matthew
Naloxone
has it.
expert, so he can tell you all about
Matthew.
that.
So naloxone is an emergency medicine that helps reverse the effects of opioid overdose.
Yes.
So many of us may not know this, but opioid, as there's a huge opioid epidemic without the 5 boroughs of New York City, especially within the Bronx area, primarily in Fordham and also the Hunts Point area.
Yes.
So one thing that we offer at BCHN is we have this naloxone education that we provide, and we also distribute naloxone kits to the community for free. We don't take nothing from the community members. We educate for a few minutes, answer a couple of questions, and then we just give out the kit. And just to give you know what it looks like.
Good idea.
Is inside. It's a nasal spray.
It's a nasal spray.
Yep, it works. So if you ever had a family member with like allergies or with the allergy spray, same kind of concept. It's a spray. It's just single use one time. Once they use it, they won't be able to reuse it. But it's effective. It works. It has saved lives before. And it's important. It's important to our mission.
So the person is unconscious, and a couple of sprays in each nostril?
Yep. So
Will
a
do
person's
the
going to be unconscious and unresponsive. So there's usually primarily 2 doses within inside every kit. And so you're going to distribute one inside one nostril. You wait a couple of minutes. And you're going to distribute the second one inside the other nostril
Those
as well.
are 2 different types?
It's the same exact medication, just in 2 forms of the nasal spray. Yep.
Okay.
Okay.
So
Got
if
it.
one
So-
doesn't work, then you would administer the second dose.
So it's just an extra dose?
Yes, just in case the person doesn't respond after
So one
dose.
spray is 1 dose?
Yes,
One
Then
spray
this
is-
is no good anymore?
that's correct.
Okay.
Exactly. Yep.
Isn't it something that has come down to this, where you have to, this is a lifesaver?
Absolutely.
This
It's as
is a
simple as
lifesaver.
doing CPR, maybe even a little bit more simple than doing CPR. And so we really want the community to understand that this is saving a life, just like if you were administering compressions or a life-saving breath to someone.
Yeah, and the feeling of saving someone's life is like unbelievable.
Absolutely.
Oh, yeah.
I was speaking to the commander, Rocky Robinson, a few months back. He just passed away. He's from the Save a Life Rescue Mission.
Yes.
He said, you don't know what it feels like to save somebody's life, to bring somebody back to life so that they can continue living their life.
Absolutely.
So yes, this is very, very special. And thank you guys for bringing this on.
No problem.
So how can you tell that a person needs this? Because there's many times that people are unconscious, but you don't know what they're out from?
So it's a very good question. So the first thing that you're looking for if someone is, they're going to be overdosing, right? So what is an overdose? An overdose is someone that is unconscious and unresponsive, and they're in a state in which the opioid has taken effect to their body, and they can no longer respond to you. They have no more of control over their functions, and so
And
they're
you
going to
pull
be
up and you see this person, you don't know anything about people who are on
Yep.
drugs, you don't know this person.
Yep. And
What
so,
do you do?
So they're going to be completely unconscious and unresponsive. And another sign to look for is in the fingertips and also the mouth.
The
Is going to
blue?
be the blue, white, or gray. Exactly. You got it right on the nose. Yep. And so this is how
No
we
air, no
identify.
oxygen.
Yep. This is how we identify if it's either drug related or opioid related. And so the first thing you want to do, you want to see if they can respond to you, right? And so like literally about 30 seconds, you try to shout at them. You want to see if they can audibly hear you, if they can come out of it.
Yeah.
If that doesn't work, you're going to take your knuckles, this portion right here, and you're going to do kind of the sternum rub or right against the chest. The point of this is physical contact. It's also very uncomfortable, so somebody should have a reaction to like, yo, what you doing? Get
You
off
got to
of me.
apply some pressure, though.
You
when
got to
do
apply
that.
some pressure
Yeah.
for a few seconds. So once you do the sternum rub, then you're going to give the nasal spray naloxone. All right, from there, and then you continue the process. You do one nostril, you wait 2 minutes. Then if they haven't woken up within then, most people do wake up within after the first dose,
Yeah.
but sometimes they require just a second one. Same medication, just the second nostril on the other side.
So this federally funded outreach vehicle is everywhere throughout the Bronx.
It will be in a few weeks, and
Yeah.
we're really
You're
excited.
getting it prepared, right? Getting it
Yes,
ready to go?
Absolutely. Getting it ready to
It's
go.
a lifesaver.
It'll be a lifesaver. We'll be connecting people to doctors, like I said, health insurance, all of those things where sometimes you just can't find the time to go to a specific place
Well, they
to
say
do it.
men don't want to go to the doctors
That
and all that
too.
stuff, so this would be a good thing for
Absolutely.
men, as well as women.
Absolutely. For anyone, we really want to
Yeah.
meet the community where they are. We usually partner with other organizations to do this, and so this is just another way for us to take make a broader reach to the community.
Now, there are some laws and stuff, so we can't bring cameras or anything and watch you guys at work.
You may be able to. You can reach out to us
just
on
can't-
social media.
From those laws, where you can't
Right,
pull up
so-
people's names and stuff
Right.
like that.
So
Yeah.
the most important thing would be protecting people's privacy, obviously. But there'll be opportunities for us to showcase our work. You can reach out to us on Facebook, social media, Instagram, our email, our website, bchnhealth.org, and we can certainly help promote the programs. We want people to know about it.
All right.
So.
So BronxNet is here to help out with that, and
Thank you.
Awesome.
just let us
Thank
know
you.
more about that. And when
Thank you.
you're going to roll on out in 2 weeks.
About three to 4 weeks.
3 to 4
All
weeks.
right,
be
and
ready.
you'll come back again, show some pictures and all that
Sure,
stuff. of the
Absolutely.
we'll be
vehicle
happy to.
in action. I know you can get behind the person that you're taking their blood pressure or giving them some sort of screening. You get behind them and not show their face.
That's right. We'll protect everyone's confidentiality and privacy.
There you go.
But we definitely want to promote the van and let people know where we'll be, what time we'll be there, and that it's open to everyone. We're
Yeah.
not, collecting any.
Yeah. How do they find out where it's going to be? You have something posted somewhere where they can go on and.
Right. So we'll have a schedule posted. We'll be promoting on our Instagram, on Facebook. All of our contact information is bchnhealth.org. So if you look at any of our social media, it's BCHN Health.
I would like to roll with you the first couple of days or
Wonderful.
something.
We'd
Like
love
that
to
would be
have
awesome.
you.
That
We'd
would
love
be
to have
awesome.
you.
Helen, you think we can set that up where we can roll with them?
Come on out.
She said, yeah, in my headphones.
Great. Thanks, Alan.
All right. So what's the website again?
www.bchnhealth.org. And you can find us on all social at BCHN Health.
There you go. Give them a big round of applause, everybody. Renee Whiskey, Community Health Programs Developer, BCHN, and Matthew Carrion, Community Health Worker, BCHN. Thank you guys so much, and thank you for your service.
Thank you for having
Yeah,
us.
keep saving lives. It's a
Thank
beautiful
you.
thing. All right, we'll take a break right here. We'll be right back with more Open next.